Americans appear to be in no big rush to get their new COVID-19 vaccine booster shot. More than 3 weeks after the rollout of the updated shots, the CDC reports fewer than 2% of adults have actually received one. Mary Wilson getting answers from doctors on who should get the new boosters and how they could prevent another winter surge.
The new Moderna and Pfizer booster shots are a combination or bivalent shot containing half the original vaccine recipe and half protection against the more prevalent Omicron variants.
So it's adapted to the circulating strain of COVID. That makes it very powerful. And it also makes it very effective against COVID today.
Moderna's chief medical officer, Dr. Paul Burton, tells Western Mass News the booster will broaden people's immune response and be more protective against the BA.5 and other Omicron variants now circulating.
People who are eligible should definitely get it. No questions about those.
Dr. Aja Damija, chief medical officer at Mercy Medical Center, is steadfast in recommending the new boosters to everyone who's eligible. Those 12 and up can get the new Pfizer shot, and those 18 and up can get the Moderna shot. You must have had your primary vaccine series and should wait 2 months after your last booster and 3 months after COVID illness.
This vaccine has been used in 800 million people around the world. It's very safe and extremely effective. People should be confident to go and get it.
Dr. Burton says although 68% of Americans are considered fully vaccinated, only a third are boosted, and far less have the updated shot at a critical time.
I think the timing is perfect. We know in Europe, in the UK, even here in America now, cases are starting to rise again. There are other variants on the horizon. So getting this shot now, you can also get it with the flu shot if you want to at the same time, makes perfect sense.
Dr. Damija also advises getting both shots at the same time.
Actually, the recommendations are to do both together if possible, because as we said, we might see some higher surge of influenza this year.
Side effects should be similar to what you experienced with earlier vaccines, headaches, fever, body aches, but Dr. Burton says they could be less intense this time around.
The data we have seems to show that, in fact, the rates of fever and achiness, those kind of things we associate with vaccines, are actually even a little bit lower with this with the booster compared to earlier shots. So I think that's good news.
2.5 years into COVID-19's deadly spread, President Biden said last week that the pandemic is essentially over. The World Health Organization said the end is in sight, but both doctors we spoke to say we aren't there quite yet.
All of us really want to put COVID behind us, but this is a virus that's here. I think it's here to stay. It continues to mutate. And we do now have these great, very effective, safe, updated vaccines. They'll protect us. Now is the time to get boosted.
Mary Wilson, Western Mass News.
On Monday, both Pfizer and Moderna asked the FDA to approve their updated coronavirus boosters for children, but those currently too young to get updated shots can still be boosted with earlier versions of the vaccine.